are closing down across Mississippi. Between 2010 and 2018, 5 hospitals closed and many more are at risk of shutting down.
WJTV 12's Gerald Harris looks at the risk of not having an emergency room. Gerald?
Terrence, Mississippi is among the bottom for health care and treatments in America, and the number of ER closures puts an added strain on an already difficult situation.
Access to quality medical care is getting harder for many living in Mississippi.
Mississippi, as you know, has very sad health indices. We have a lot of negative indicators.
Dr. William Cecil studied the impacts of public health care for many decades and says Mississippi still has a lot of work to do.
So we have a huge challenge to try to improve the health of the population.
Dr. Cecil says preventative health care is important and could curb the need for rural Mississippians to need emergency services.
More than curative medicine, preventive methods and promotion of health help to improve the health of the population, both individually and then as a group.
And lawmakers on both sides of the aisle say something needs to be done about rural hospital closures.
We have not had any major updates or reforms in our healthcare system in our state in a long time, and we've got to put all options on the table.
He adds due to the high rate of uninsured people in Mississippi, the hospital's ERs cannot operate while losing money.
The problem with that is you can't run a business losing money, and that is the problem a lot of our rural hospitals are facing right now.
Every time a hospital closes, you've increased the chance of death for everyone that lives within a 20-minute radius of that.
Hughes says it's bound to get worse.
Well, it's very simple. When you're in last place with access to health care and you don't do anything to increase it, it only gets worse.
48% of Mississippi rural hospitals are rated as having high financial risk, according to Navigant Consulting.
And Mississippi is among 14 states that have not expanded Medicaid. Some have argued that will prevent many of these hospital closures. It is not something being brought up in this legislative session. Melanie?